Good evening, everybody. Myself, Dr. Arunava Patra. I'm a consultant physician and pulmonologist practicing in South Chobis Pargana, most of the south part of the South Chobis Parganas, and in Paschim Medinipur. My hospital is Nagar Multi Super Specialty Hospitals. So today we are going to discuss in very interesting topics, and it's a very relevant topic rather. The topic is that can the probiotics help in the managing acidity? Yes, we all know about the probiotics, that the probiotics are often referred to as a good bacteria, having a gained popularity for the potential health benefits, including the aiding the indigestions and promoting the gut health. But can these probiotic manage the acidity? Is really big issues. So before going to discuss in the proper topic, we should go to understand that what is probiotics. Probiotics are the live microorganisms, primarily bacteria and yeast, that confers the health benefits often consumed in adequate amounts. These beneficial bacteria help managing a healthy gut microbiota and support the digestive functions. And before we're going to discuss this mechanism of actions, we have to understand that from the very long times, having the concept of this probiotics, we have taken yag nuts at very regular intervals. That is a very good source of probiotics. So actually how it works, probiotics may help in managing acidity by modulating the gut microbiota and reducing the inflammations in the gestational tracts. Certain beneficial microorganisms produce in short-chain fatty acid. This short-chain fatty acid is very important. It is digested in the stomachs and in the gut that produce and regulate the acidity. So the acidity will reduce. So as far as now the discuss matters that these bacteria produce the short-chain fatty acids. This short-chain fatty acid promotes much more product that regulate the acidity, and it also helps in the pH balance in the gut and balancing our health. What is the evidence that is supporting the probiotic for acidity? Some studies suggested that the probiotics may help in alleviate the symptom of acid reflux, heartburns, and gastroesophageal reflux disease, that is GERD, by reducing the acid productions and improving the esophageal motalities. So a meta-analysis of randomized controlled trials found that the probiotics were associated with the significant reductions in the symptoms, acid reflux, and GERD compared to the placebos. However, the more research is needed to establish the optimum strengths, doses, and durations of probiotic therapy in managing the acidity and after reflux. In that perspective, I would like to share in very interesting things that there isn't so many probiotics which can be used in BD doses and some used in OD doses. What is the importance of BD doses and OD doses? Some says that the live bacteria can produce and much more product, free fatty acids. So the live bacteria is present that can be used in a single dose. But in can have acidophilic, inactivated bacteria in the patients that we have to give, and its product. Sometimes the product can be used. That product may be used BD doses. So that can control in both OD and BD doses, in particular that setups. However, the more research are needed to establish the optimum strengths, optimum doses, and for OD and BD dosing, like thrice daily dosing may be needed. So that is very important points. And choosing the right probiotics, that is very much important, because the which probiotic you would like to use in particular setup. When selecting the probiotic supplement for the managing acidity, formulations containing the strains such as Lactobacillus acidophilus, Lactobacillus reductus, Bacillus species, Bacillus strains, and yeast belonging to the genus the Saccharomyces that have been studied for their potential benefits. The strains have been proven efficacy and alleviating the GI disorders. So in essential, in concert of the healthcare professions regarding the dietary supplements is very important for its perspective. I would like to give an example. In case of chronic diarrhea, you all know there is a certain role is probiotic and prebiotics. So particularly in a probiotics, we use this probiotic chronic diarrhea in a long-term fashion. That means in case of 2 to 3 months, after the 2 to 3 months, we get the result. That result is very much astonishing that the chronic diarrhea is reduced. And in case of IBS in diarrhea varieties, we all know this then probiotic has a very much potential role for managing the gut health. So the history is very important. There is the incorporating probiotics in rich foods. We may plan there is in drugs we can use in drugs format. We can use in the food formats. Some drugs, some food material contains so much of probiotics that we can use it at ease. In addition to the supplements, the incorporating the probiotic rich food diet such as yogurt, kefir, kimchi, and kombucha can be beneficial. These fermented foods contains a live colonies of beneficial bacteria that can support the digestive health and potential aid for the managing the acidic symptoms. While the probiotic show the promises in a complementary approach in the managing the acidity, they should not replace the conventional medical therapy or the lifestyle modifications. So no doubt, definitely it has an pH regulation role, but the PPI, the normal PPI which are commonly used, that must be used accordingly. So that is not replaced by that particular drugs. A very important thing is that the certain probiotics can also be contraindicated for some patients. It has to be a great importance that all the bacteria we cannot be used in the same, probiotic cannot be used in the same fashions, because some patient may have an GI problem that is probably immunocompromised state. That particular set of patient may have much more proliferations and have some real set of problems. So in that group, that set of people have to be considered. It is important to consult the healthcare professional before taking an probiotic supplementations. So we are randomly just starting the probiotic. It's not a manner. We have, before starting these drugs, we have to consult the health professionals, and then we will be used in particular certain manners. And have to be ensure the optimal benefits and appropriate use based on the individual's health status. So that is a very important point, that the individual's health status must be considered. Otherwise, there is a real problem for these particular things. As you know, there is a future trend in probiotics. Gut microbiota can be often filtered from our and that particular strains from the filtered and can be used as a replacement in certain disease like chronic liver disease. We can use in gut microbiota, particularly in the set of group of the patients. And some spontaneous bacterial peritonitis. It can prevent the spontaneous bacterial peritonitis. Even we can use in certain diseases which can be not in unconventional way, like it can be effect in certain brain diseases. Probiotics, no doubt, processed till now, various probiotics in the markets, and the probiotics, most important probiotics are the live probiotics, which can be used in a single dose and having a lot of potential benefits for the particular reasons. And its mechanism of actions, we all know that the short-chain fatty acids. Short-chain fatty acid is very much important. As we know, these short-chain fatty acids control the pH of the gut, and these pH is maintaining the acidity, and so the reflex of will be reduced. Reflex is very much reduced for the particular sets. And regulations of regular diet is very much important as we concern from these point of views. So after discussing the whole scenario, we have a take-home message that these probiotics can be used in certain conditions to maintaining the acid pH balance in the gut, as well as to controlling some diseases like chronic diarrhea, gastroesophageal reflux disease, and inflammatory bowel disease, in diabetic, in loose diarrhea varieties. So particular that set of group of patients have a lot of important role for these things. Before using that, we have to think that the patient having whether a patient having any contraindication, particularly some having gut problems, which can proliferate after using the probiotics. So before starting, we have to consider that the patient, whether patient having any immunocompromised state or patient having any gut problems, like we can proliferate much more things, have to think. And we can also use and the third point is that we can use the homemade probiotics, that is Yagnat, like that. If we eat regular fashions, no doubt it will improve our gut health, and definitely it's a very important discovery in the futures, and it has definitely a good prospect in futures. So thank you very much for your patient hearing.